there are fewer people available as caregivers compared to a year ago. And it's actually a bit of a tight squeeze right now to take care of all the healthcare needs of the nation, of the region. And for that reason, we really need people to pay very close attention to personal risks that they take to try to help us keep the number of cases down in the region and decrease the impact on the health system. Later, we'll talk a little bit about what we know about Omicron. Still not a lot of news, but we're starting to get some picture, as well as an update on boosters and a few other topics that we'll get to. So first of all, just looking at the pandemic curve in the U.S., this graphic once again on the left shows the cases in the country, and on the right, the mortality rate. And once again, at the far right of each graph, you can see that the case rates have turned back up, and now we look like we're seeing the mortality rates increase as well. Currently, the predominant activity is in the upper Midwest and New England. And again, it's following a line that looks like it's following a bit the seasons, and as colder weather increases, that line of high activity seems to be moving down, including across the Missouri and Illinois region. And in fact, if you look at the case rates in our region, we're seeing a substantial upturn. At the far right, you'll see a number of very tall green bars. Some of those green bars represent pent-up cases that hadn't been reported before, that were reported into the system all at once, and some makeup from the Thanksgiving holidays. But the blue line, which is the 7-day rolling average, really smooths those changes out. And it's fairly apparent that we have now pushed past our peak that we saw in September, and we're on a slope that is comparable to what we saw a little over a year ago with our run-up in October and November. Of course, a difference between now and then is we now have many vaccinated people, and yet we're still seeing some pretty substantial case numbers. Looking at the week-over-week change in the 14-day rolling average, a 32% increase, which is pretty striking. And again, some of that may be an artifact of the way data were being reported and catch up, particularly on the Missouri side of the metropolitan area. We also see the reproduction number. Just a reminder that when that number is below 1, the number of cases is starting to contract. When it's above 1, it's expanding. This number of 1.43 is close to the highs that we saw at the very beginning of the pandemic. I, once again, think that that number is probably a little bit overestimated based on when it was calculated relative to these data reporting irregularities. But the bottom line is, I think we're well above the 1.2 number at the very least, which means this will expand fairly rapidly without interventions. The number of new hospital admissions is increasing, 57 per day. That's our 7-day moving average. We haven't quite gotten back up to the August peak, but our numbers are increasing, and the daily net hospitalizations or hospital census is pushing 500. Again, we're not quite up to where we peaked in August and September, but we know that the hospitalization data will lag the case rates in the region, so we expect that to continue up. I'll have a little more information about modeling what's going to happen next in a few minutes. Currently, there's 479 people in task force hospitals, with almost 100 in the ICU census number and over 60 on ventilators. Again, very high numbers compared to what we saw in November. And last week, we delivered a record 456 monoclonal antibody infusions that we know about. There are additional infusions being administered in the region. We don't have every single infusion noted on this, but this is the highest number we've seen thus far. And on the one hand, I'm very happy to see people taking advantage of this therapy, which is really the only thing that's been shown to help forestall mild cases turning into more severe cases. On the other hand, this does mean that we have a lot of people with early COVID that we're getting a chance to infuse antibody into. mortality rate at a 7-day moving average of 5 cases. It's up a little bit from our nadir that we saw in November. Has not caught up with the case curve yet. And once again, we hope that it will stay low, but we are still seeing on average 5 people in the metropolitan area dying from COVID each day. In terms of the vaccination rate and breakthrough cases, right now in the 3 task force hospitals who are reporting this information, 23% of the hospitalized patients represent breakthrough cases. And as I've reminded people each week, the majority of those are individuals who are over 65, have diseases that compromise their immune system, or have other medical problems that make it harder for them to handle the impact of COVID. If you look at this rate over time, it has gone up. And we went from a rate that shows here in the 10% range. It was even lower than that actually initially, and it's crept up over time. Why it's moved up is probably due to several factors, but one of the ones that's most important is waning immunity from those people who had early vaccinations. Again, we've seen this phenomena pretty broadly across the country, and we got up to almost 30%. More recently, it's flattened out. Part of that may be due to the renewed interest in getting booster vaccines, and that may be helping some of those more vulnerable individuals stay out of the hospital. Whatever it is, we still can show and confidently state that vaccination is tremendously protective against risk of hospitalization and death. Currently, there are 12 pediatric age patients in hospitals regionally, with 1 in ICU. That number is up a little bit off of our recent low. And unfortunately, one of the things we're hearing about Omicron is a propensity to cause disease in a younger population. So we may continue to see this number rise, and that may be boosted further with Omicron, although we don't have firm information on that. Yesterday, we discharged 60 patients from task force hospitals. We're up over 31,000 people who've been hospitalized with COVID so far in the 4 task force hospital systems. Projecting ahead, the models have changed quite a bit. As a reminder, each black dot represents the number of people we had in hospital on that particular date. The center blue line is our best guess about the trajectory we're on, with the darker blue line the upper bound and the lighter blue line the lower bound. And this has changed dramatically from the downslope that we experienced in October. It's really a function of both the transmissibility of the virus, as well as the immune status of the population, and what precautions people are taking in terms of masking and social distancing. So right now we are losing ground against the virus and seeing a pretty clear escalation in the region. The same can be said for the ICU census, where once again we're turning up. It tends to lag just a little bit behind the overall inpatient census, but both of these numbers are showing pretty striking upturns. And once again, I think the rates of increase are getting pretty similar to what we saw in October and November of last year. The vaccination rates in the various counties that comprise the metropolitan area have picked up some. You can see very large bars in the sort of the blue-green color that represent people who've had a single vaccination. And looking across all the counties, those blue-green bars are getting bigger, which means more people are electing to get vaccinations, which we think is appropriate and very important for helping contain this. The number of individuals who are fully vaccinated is in blue. For the region, we're sitting at about 52 to 53%. These numbers may actually underestimate vaccination rates a bit, but maybe just a few percentage points, probably not more than that. This is displaying the same county data, looking at different age groups across the Missouri Region C. So this is not any of the Illinois side counties, but the more extended county map on the Missouri side. The youngest patients 5 to 11 are in the leftmost column, and those who are over 65 are in the rightmost column. And as you might expect, there actually is very good vaccine uptake in the 65 and older generation in most counties. Some counties are pushing almost having 100% of people having one or more doses. As you get to lower and lower age groups, we see fewer and fewer people vaccinated. And of course, in the 5 to 11-year-old group, we have not vaccinated a lot of people yet, and very few kids have full vaccinations at this point. So those are the story that the data tell. And we will really cover three particular areas. First of all, the increased cases and whether we have additional insights into the cause of recent volume surge. Cases are really dependent on the immunity in the population, what steps we're taking to reduce transmission, and how easily transmitted the virus is. I think what we are seeing in this time period is clearly partially due to reduced masking and distancing as people have gotten tired of these precautions. But I think they're certainly a noticeable decrease broadly. In addition, colder weather is driving people indoors, so there's more contact among individuals in the population and more opportunities for spread. The next question is whether Omicron might be playing a role in these surging volumes. And to be honest, we know we've had at least one case identified, and it wouldn't surprise me if we find that there are other cases of Omicron that are already in St. Louis. That said, if Omicron is not here, we're already having a pretty aggressive surge, and Omicron's arrival will no doubt only accelerate the number of cases. So I think that we have to be prepared to take pretty aggressive action if we want to contain the current spread. I will also mention that waning immunity is probably playing a role in terms of breakthrough infections as well. So for those who are eligible for boosters, which we'll get to in a minute, I think it would be very important for people to avail themselves of that opportunity to get the booster vaccine as soon as possible. The third question about the increased cases is how hospitals are prepared to manage the increasing volume. Hospitals are very experienced at this point in understanding how to manage COVID cases as they arrive. So we're all pretty adept at the infection prevention procedures and practices that are required. We know how to handle critically ill patients. However, we have a less buffer capacity than we had a year ago, and there are fewer people available, fewer caregivers. Staffing concerns continue to plague hospitals all across the country, and St. Louis is no exception to that trend. So I think people need to be aware that once again we may enter a period where more elective healthcare activities may need to be put aside for a time. We're also seeing extreme crowding in our emergency rooms, with many people having long dwell times in the emergency room waiting for a hospital bed. That also means that people who are not going to be admitted may be waiting longer in emergency rooms. Please, if you don't have a serious illness, take advantage of going to your own doctor or urgent care to take care of more minor problems, to try to keep the pressure off of the emergency room where we're obligated to evaluate anyone who arrives at that front door. Turning to Omicron, the first question is whether it spreads faster than Delta. We still don't have firm data on this, but virtually every place that's looking at it has come to the conclusion that it probably does spread faster. There have been some estimates that it might be as much as twice as fast as Delta and earlier strains. But I think that's too precise an estimate. What we can say right now is that Omicron is likely to spread through the population more quickly, and if so, will likely start to replace Delta as a major factor. The second question is whether the symptoms of Omicron are different. And we've seen no information that suggests they're particularly different in terms of the constellation of symptoms. Still largely an upper respiratory virus with an extension down into the lungs as it progresses. Loss of sense of smell and taste is still a feature. What we can't say at this point is whether Omicron is more or less aggressive or more or less virulent than Delta. The data so far suggests that it may actually be somewhat less severe, which would be good news. But I think that has to be tempered with the understanding that a lot of the early cases that we've seen abroad have been in younger age groups, particularly South Africa, where the story first became so evident. Many of those cases were in younger individuals, and it's hard to draw conclusions about severity because that may be more a reflection of who's getting infected than the characteristics of the virus. And finally, when will we know how effective the vaccine will be against Omicron? I think there'll be some circumstantial data that will accumulate over the next week or two. Then we'll start to see laboratory data that will speak specifically to whether the antibodies raised against the vaccine are neutralizing for the Omicron variant. And as time goes on, we'll see more robust data from population studies about how those who have been vaccinated, and particularly those who have been boosted, are faring with Omicron. Moving on to boosters, the question is who qualifies for boosters? At this point, anyone who's 18 and older who's received a vaccination, a primary vaccination series, is eligible for a booster if they're 6 months out from receiving either Pfizer or Moderna, or 2 months out from receiving Johnson & Johnson. And once again, a reminder that you can get a booster with any vaccine type, no matter what you received on the first time. The second question is, how important is it for everyone to quickly get a booster, even young, healthy adults, and why? I think from what we're seeing right now, it's important that people get a booster as soon as they can. As we've talked about before, every shot in an arm does depress transmission somewhat. So for individuals who may have waning immunity, it's important that they get a boost to try to help them stave off Delta infection and quite probably to provide some protection against Omicron, although we don't know the full benefits of the vaccines for Omicron yet. And finally, what is the status or availability of the pills or other therapeutic agents to treat COVID? Right now, there are really 4 agents available. Actually, more than that, but one group of agents, monoclonal antibodies, that have been shown to be effective. And there are a couple of different preparations that are available in the St. Louis region. Those have been shown to be roughly 70% effective in preventing mild cases from turning into something that might be more severe. And I encourage anyone who has COVID, who has any sort of risk for progression, to talk to their provider about getting monoclonal antibody therapy. There are also 3 oral medications that have shown promise. 2 are experimental drugs, one from Merck and one from Pfizer. Both of those are under review by the FDA. The FDA recently recommended that the Merck drug be approved for emergency use on an EUA, the same way some of the other anti-COVID drugs have been approved. That medication, as the data have progressed, seems to be relatively less potent than was first imagined. The most recent estimate I saw was about a 30% protection, which would mean it's not quite as effective as monoclonal antibody, but it does have the advantage of oral therapy. The Pfizer drug in early data has looked to be a bit more potent, but we don't have full information, and it's not as far along in the approval process. And a third medication, fluvoxamine, which is a drug used for treating anxiety, has had some preliminary data suggesting that it may be useful. We're still waiting for enough firm evidence to put that on the list as a suitable alternative. So for right now, I think the thing to keep in mind is the only really well-documented effective therapy is the monoclonal antibody preparations that are available, with other drugs potentially in the pipeline. None of these should be thought of as a substitution or a reason not to get vaccinated. It's absolutely clear that strong vaccine immune response is a better way to go than waiting till you're sick with COVID and getting one of these medications. This concludes today's briefing. I think it's a very dynamic time, and I encourage you to keep in touch as we watch what happens over coming weeks We'll be continuing to have interviews and press briefings as required to keep you apprised of the latest information. Thank you.